Hola! Welcome to Case Stories by Dr. Josie, that's me, where you get to hear and learn stories from the hospital. Today's story is a bizarre one. Have you ever had a human bite you? And did you know that such bites should be treated in the hospital? Have you ever been told that a human bite is very infectious? By the way, I talk and post about stories from the hospital. If this is your thing, please consider subscribing and sharing. This story is from Dr. Rose. So one day she's in casualty dealing with patient coming in out, and she noticed a middle-aged man that came with his left hand being dark. And on closer examination, the doc will see that this part of the forearm, this part is called the forearm, is darkened, and the patient could not move the fingers well. And also there were pus pockets, and it was foul smelling. The first thing you want to know is, since when did this thing happen? And the patient said it has been there for a while. When asked what caused it, the patient said he had no idea. This is so concerning, because if a hand can appear black out of the blues, it means anyone can get it. But at this moment, we still don't know what has caused the darkening of the arm. On closer examination, the doctor discovered that the damage was extensive. It was below the skin, and it was rotting down to the bone. In such scenarios, we usually manage the patient in theater, where we need to take out this dead tissue, because with the dead tissue, no new tissue can grow, and this will lead to further death of the arm. So in theater, they discovered extensive damage. There was a lot of dead debris, which they removed and cleaned, a process called debridement. And the thing with debridement, when you come to decide to do debridement, it means that there's a lot of dead tissue that cannot be taken out in casualty. So at this point, we are dealing with damage control. So the patient is admitted because he needed to undergo a series of debridement. That is, when you're taken to theater, the dead tissue is removed, it is cleansed, and then you're put on antibiotic therapy. You're taken to the ward, you stay for around 3 to 5 days, and then the wound is assessed again, and you evaluate if there is need to remove more dead tissue, or from there on, you can now start treating the wound, hoping that it will heal. And also you may consider skin grafting later on. So the patient underwent 3 series of debridement. That meant there was a lot of dead tissue. After 5 days, patient is taken back to theater. They see there's no really much improvement. There's still dead tissue, which is removed. And then you stay for another 3-5 days. So this is what is meant when we talk about a series of debridement. The patient is managed, as I've said, 3 debridements, and then from there on, we were doing wound care. Now, on wound care, we manage it such that every day the wound is evaluated, it is cleaned, and you decide if to close it or leave it open. And the patient has been in for the debridement for a while, and one day the doc had a commotion outside. It was near the wards, and she found that this patient, our particular patient, was arguing with the wife. And there was a lot of verbal abuse, and it seemed like it was something they were used to. It's just domestic violence. And the woman uttered and said, "Na ukicheza nitakuuma tena." Ding, ding, ding. So alarm bells went off, and the doc now realized where this problem was coming from. Apparently, it was a human bite. The wife had bit the husband, and the husband did not seek medical care, which brings us to today's topic, which is human bites. And do you know human bites are the third leading bites that we see in hospital? That is after cats and dogs. And by the way, there's a previous episode I've talked about dog bites. You can check that, by the way. And the thing with human bites is we have so much bacteria in our saliva, and epidemiology gives it at 100 million microorganisms per 1 milliliter of saliva. And also the organisms can be of different species, up to 190 types of species. So this, we are talking of a very germ-ridden space. That is why human bites cause a lot of infections. Human bites are common in the hand area. And to make matters worse, human bites in the hand area are more likely to get infected than any other part of the body. And if you think about it, it's because of the thinness of the skin. You can't compare this type of skin as opposed to a thigh. This one is more close to the bone as opposed to the thigh. That is why human bites of the hand are mostly infected. And we have a type called clenched fist. As it is stated, it's a clenched fist. This is mostly seen when people are fighting and you happen to hit the mouth of an individual. The other type we commonly see is from aggressive type, now from like domestic violence, from child abuse, from sexual assault, from nose biting. Nose biting is a cultural practice that is done in some cultures that is a form of punishment for adultery. So you can also see that. Also, you can see in seizure-related tongue biting. There are many incidences in which you can find human bites. Even in children playing aggressively, that is also a type of human bite. So you shouldn't ignore any condition in which the human teeth come in contact with the skin and there is a breach of the skin. And with human bites, the meticulous wound care is the cornerstone of human bites management. So a lot of cleaning and assessing the wound is, you decide if you will leave it open or you will close it. It's also associated with a lot of antibiotic therapy. This is before an infection and also to treat an active infection. Also, we give tetanus shots. I know most people who have experienced this, got a tetanus shot, and you're advised on how to take care of your wound. As I've stated, meticulous wound care is the cornerstone of human bite management. So next time you get such a situation, it is a medical emergency, seek medical care. And as I've stated, more commonly on the hands, it is highly going to be infected. So seek medical care. And it doesn't have to reach to that damage that your hand is rotting down to the bone. And we want to thank Dr. Rose for sharing this story. Till next time, ciao.